So another big controversy that young women face these days is what's the optimal local therapy? We know from big studies that lumpectomy followed by radiation is equivalent to mastectomy for women with breast cancer, both young and old. And yet there's an epidemic in our country, the United States, of doing bilateral mastectomy for unilateral breast cancer, including among women who are not at high risk of a new primary breast cancer in the other breast. And so a lot of work is going into trying to understand, why is this happening? Is it doctors driving it? Is it patients driving it? Is it culture and society driving it? And it's probably all of the above, but I think we need to figure it out, and we need to also help women to make the most informed decisions, because there's also some inaccurate perceptions surrounding what it will mean to take off the other breast when you don't have to, both in terms of how complicated it might be. Some women think, I get them off and I'm done and my risk is gone, when most of their risk is actually due to recurrence elsewhere in the body. And then some women think that it's going to be easy from the standpoint of get them off and then I'm all done with the surgeons and done with this nuisance. And the fact is that there's lots of visits to the plastic surgeon, because most women reconstruct and there's potential for complications, and it can delay things like chemotherapy. And women are generally happy with what they choose, whether it's lumpectomy followed by radiation or bilateral mastectomy or unilateral mastectomy. But of course we don't have randomized trials for this. And a lot of women, and we think, are choosing to do the other side despite a mortality advantage for peace of mind. And the question is it providing peace of mind? Is it real false peace of mind or real peace of mind? And if it's false peace of mind, how can we help to educate women but also support them in a patient-centered way?